It gives me great pleasure to present an Exceeding Expectation Award to Neil Jarvis. Neil usually works in the TB team, but when COVID-19 happened, he was asked to move to open and manage Ward C17, which was cohorting COVID-19 patients. He did this with nurses, healthcare assistants that had been redeployed from across the hospital and across the trust. That is no mean feat. Bringing a team together of people that have not normally worked together is very, very hard and difficult to achieve team working. Neil confidently and competently set up the ward, led by example, and managed to guide us, the team, through one of the hardest jobs that I believe they will ever face in their career. And he made the team cohesive. He also had a group of OSCE nurses working with him, and they watched Neil and interacted with him, and he taught and watched these nurses flourish. That was absolutely excellent. I cannot thank Neil enough for what he has done. This wasn't an easy role to step into, and he really justly deserves an Exceeding Expectations Award.
My name's Mike and I nominated Neil Jarvis for the Exceeding Expectation Award. I did this because a couple of months ago Neil was asked to move from the TB team and help set up and manage Ward C17, which was the COVID ward here at New Cross. Many of the nurses had been redeployed across the trust into this role, and some of them hadn't worked on a ward before. There was also OSCE nurses that had been asked to work on there as well. During this time I watched Neil set up and manage the ward and lead safe and effective care, communicating with all his staff and managing to teach a lot of these nurses new skills. And I watched a lot of the nurses in this environment flourish under Neil's leadership. It was a very hard ward. It was very difficult at times, but Neil provided great amount of support to us all. It actually made one of the hardest jobs I've ever done in my career probably one of the most enjoyable, and that was down to Neil's leadership.